Okay, hi everyone, my name's Zoe and I am a registered mental health nurse and a lecturer at the University of Bolton, and I'm also a professional doctorate student. Around about 3 years ago, I stopped taking the contraceptive pill for probably the first time since I was 14 and had my first experience of periods as an adult and my first experience of PMS. I was really surprised by how my mood would lower, my resilience would go down, I'd feel really anxious, and I just felt like a completely different person. It was at this point that I wondered, if I'm feeling like this, how must my patients who are diagnosed with mental health conditions be feeling? No, I can't do it. Okay. I did the research and I found that there was a definitive link between different phases of the menstrual cycle and a worsening of depression, anxiety, PTSD, eating disorders, psychosis, and bipolar disorder. I also found that there was a really big increase in suicidality and self-harm. And alongside that, even more surprisingly, there was a 13% increased risk of being admitted to a psychiatric hospital during the PMS phase, which is saying that over 1 in 5 women who were admitted to psychiatric hospitals were admitted during their PMS and period phase. This was really surprising to me. The reason I put this on the screen is because it wasn't in my nurse education. It wasn't in the care plans that I completed as a nurse. It wasn't in the admission and discharge documents that I completed. It wasn't in risk assessments. It just wasn't usual practice to be thinking about the impact this might be having on the people that we were treating for, which means there is a chance there is a real big inequality taking place across UK healthcare at the minute. Anybody who has done postgraduate research knows how important it is to find that gap in knowledge that your study is supposed to cover. This gap wasn't hard to find. This gap is a huge gap. And an even more under-researched area within this is the impact that it's having on people with borderline personality disorder. Now, the reason I am studying borderline personality disorder is the past decade has seen a huge increase in people being diagnosed with BPD and being admitted with BPD. Now, a reason for this is one of the most hallmark characteristics we see of BPD is something we call emotional dysregulation, which causes the symptoms you can see on the screen right now. The consequences of these together are seen in a massive increase in crisis admissions, increased cost in NHS, increased length of stays, and a huge amount of people being placed in out-of-area placements because healthcare systems just can't manage the influx we're seeing. There is also a huge issue with stigma and discrimination from healthcare professionals towards this group, probably one of the biggest issues of stigma and discrimination we've seen for decades. The gender split for borderline personality disorder is around about 50-50, females and males experiencing it. However, women are much more likely to end up in healthcare, and women are much more likely to commit very violent acts of self-harm to themselves and are at risk of accidental suicide due to things such as repeated overdoses. And this is why it was really important to me to be looking at this. So the study that I'm proposing is looking specifically at emotional dysregulation in people with borderline personality disorder and the impact that the menstrual cycle is having on that. I'm doing a 3-month study where I'm first looking at the daily impacts, so the daily symptoms. I'm asking the women to tell me about their emotional dysregulation every week so I can match it against the menstrual cycle and see what impacts that's having. And I'm also meeting the women monthly to do semi-structured interviews. I know this is a big study for one person. I am so scared. It's fine. Meeting with them monthly to see how they relate to their own experiences as well. And it's my hope that doing this kind of study can bring a parity to the physical and mental well-being that we're seeing. But this isn't all that's needed. So in healthcare, there is a huge emphasis on holistic care, but are we really delivering holistic care if we're not considering the impact that menstruation is having on 50% of our patients? When I was doing my search, I looked at every piece of policy, guidance, every mental health charity that I could find, and there was hardly anything about normal menstruation and mental well-being, and there was nothing for people diagnosed with mental health conditions. I mean, nothing. This was hours of research. So what do we need to do? We need a lot more research. Like I said, it's massively under-researched. We need more people to be doing these kind of studies. Healthcare education needs to change. We need to be changing the way that we're thinking about psychological well-being and its link with physical health conditions. We need to change the way we're thinking about holistic health. And it's my hope that these changes can bring more policy, bring more guidance, and bring more parity to the way we're dealing with physical and mental health together. And that's me. Thank you.